Hello everybody. Before we begin, let me introduce myself briefly. I'm Indah Putri and I'm a nurse student of Muhammadiyah University Semarang. Today I'm going to be talking about hepatitis B. Do you know hepatitis B? Okay, first of all I want to explain you what is hepatitis B. Hepatitis B is a serious liver infection caused by the hepatitis B virus or HBV. For some people, hepatitis B infection becomes chronic, meaning it lasts more than 6 months. Having chronic hepatitis B increases your risk of developing liver failure, liver cancer, or cirrhosis, a condition that permanently scars of the liver. How about the signs and symptoms? Signs and symptoms of hepatitis B range from mild to severe. They usually appear about 1 to 4 months after you've been infected, although you could see them as early as 2 weeks post-infection. Some people, usually young children, may not have any symptoms, and the symptoms can include yellowing skin and eyes, dark urine, light-colored stools, nausea and vomiting, loss of appetite, extreme fatigue, diarrhea, tummy pain, abdominal pain, and fever. And what are the causes of hepatitis B? Alcohol abuse, IV drug use, heredity, drugs, viruses, sexual contact, sharing of needles, accidental needle sticks, and mother to child. For sexual contact, you may get hepatitis B if you have unprotected sex with someone who is infected. The virus can pass to you if the person's blood, saliva, semen, or vaginal secretion enter your body. And for the sharing of needles, hepatitis B virus easily spreads through needles and syringes contaminated with infected blood. Sharing IV drug paraphernalia puts you at high risk of hepatitis B. Accidental needle sticks. Hepatitis B is a concern for healthcare workers and anyone else who comes in contact with human blood. And for the last, mother to child, pregnant women infected with hepatitis B virus can pass the virus to their babies during childbirth. However, the newborn can be vaccinated to avoid getting infected in almost all cases. Talk to your doctor about being tested for hepatitis B if you are pregnant or want to become pregnant. Who are at risk for hepatitis B? Have unprotected sex with multiple sex with or with someone who is infected. Share needles during IV drug use, are a man who has sex with another man, live with someone who has a chronic hepatitis B virus infection, are an infant born to an infected mother, have a job that exposes you to human blood, travel to regions with high infection rates of hepatitis B virus such as Asia, the Pacific Island, Africa, and Eastern Europe. And what are the complications of hepatitis B? Having a chronic HBV or hepatitis B virus infection can lead to serious complications such as scarring of the liver or cirrhosis. The inflammation associated with a hepatitis B infection can lead to extensive liver scarring or cirrhosis, which may impair the liver's ability to function. For the liver cancer, people with chronic hepatitis B infection have an increased risk of liver cancer. For the liver failure, acute liver failure is a condition in which the vital function of the liver shuts down. When that occurs, a liver transplant is necessary to sustain life. Other conditions: people with chronic hepatitis B may develop kidney disease or inflammation of blood vessels. And what are the prevention of hepatitis B? The hepatitis B vaccine is typically given as 3 or 4 injections over 6 months. You cannot get hepatitis B from the vaccine. The hepatitis B vaccine is recommended for newborns, children, and adolescents not vaccinated at birth, those who work or live in a center for people who are developmentally disabled, people who live with someone who has hepatitis B, healthcare workers, emergency workers, and other people who come into contact with blood, anyone who has a sexually transmitted infection, including HIV. Men who have sex with men, people who have multiple sexual partners of someone who has hepatitis B, people who inject illegal drugs or share needles and syringes, people with chronic liver disease, people with end-stage kidney disease, travelers planning to go to an area of the world high hepatitis B infection rate. And what precaution to take to avoid HBV? Other ways to reduce your risk of HBV include: the first, know the HBV status of any sexual partner. Don't engage in protected sex unless you are absolutely certain your partner is not infected with HBV or any other sexually transmitted infection. And the next, use a new latex or polyurethane condom every time you have sex. If you don't know the health status of your partner, remember that although two condoms can reduce your risk of contracting HBV, they don't eliminate the risk. And don't use illegal drugs. If you use illicit drugs, get help to stop. If you cannot stop, use a sterile needle each time you inject illegal drugs. Never share needles. And the next, be cautious about body piercing and tattooing. If you get a piercing or tattoo, look for a reputable shop. Ask about how the equipment is cleaned. Make sure the employees use sterile needles. If you cannot get answer, look for another shop. And for the last, ask about the hepatitis B vaccine before you travel. If you are traveling to a region where hepatitis B is common, ask your doctor about hepatitis B vaccine in advance. It's usually given in a series of 3 injections over a 6-month period. Okay, if you have questions regarding the focus of this presentation, please feel free to contact me at my email indausman65@gmail.com. And finally, I would like to finish this presentation with this quote from Francis Bacon that says, "Knowledge is power." Okay, so thank you for listening my presentation. I hope this presentation has given us new insight on the hepatitis B. Have a nice day everyone. See you.